This is a very good question. I get this asked a lot. Now, what's interesting is vast majority of the patients that go to plastic surgeons believe that breast implant illness, believe it or not, is a myth. It doesn't exist, and it's all psychological in the patient's head, which is wrong. The FDA and also the manufacturers themselves have accepted the fact that there is this phenomenon of brain fog, confusion, joint pain, rheumatological joint issues, connective tissue disorders. Patients who are depressive should not get implants, and if they do, or there is risk for potential rupture or concern for rupture, they should seek attention and see a board certified plastic surgeon. Now, this is where the patients need to do their homework, and they need to understand that the explant surgery entails that your surgeon is removing implants only, and that your surgeon is not only removing the implant but also the capsule completely, sincerely, definitively, and if and when the implant is below the muscle directly on top of the rib, and the entire capsule is removed, because this is the treatment to free the body of the many symptoms of breast implant illness. And we know this because those patients that had partial removal of the capsule, incomplete removal of the capsule, or the silicone spilled into the chest, the patients continue to hurt, and only when the residual capsule is removed or the silica is completely definitively removed, which is embedded within the soft tissues, only then do the patients bounce back to a normal state of good health. And these are patients that have clearly benefited from what is proper explant surgery. Again, in summary, where the implant is removed along with the capsule that's around that implant that has formed, plus the tissue around that implant that is causing that inflammation that causes the patient hurt. So all of this must be removed, and once removed in what is the en bloc fashion preferably, or 100% total capsulectomy, this capsule is then sent to pathology to rule out the BIA-LCL, BIA-SCC, breast cancer, anything abnormal, including silica. Cultures are done for bacteria and fungus, and then the patient can, with good certainty and confidence, say that there is no inflamed tissue remaining behind, and now the patient has the best chance to bounce back to a normal state of good health. This is Dr. Khan, Executive Plastic Surgery.